Good morning, guys. I hope we're all sparkly. Her Royal Highness has told me to do a video, so I must obey. Here we are, in the landy, one more time. Earn your reward. I've been to the gym, I've run the dogs, I've popped into clinic to pick something up. Work never ends. The world's smallest violin, just in case you wonder what I was doing. Nobody cares, work harder. So I'm going to talk about my favorite topic, sex, hormone binding globulin, the most fascinating glycoprotein in the world. I've spoken about it before, so check out those videos. So what is SHBG? It's a glycoprotein produced by the liver. It helps modulate the ratio of testosterone to estradiol to DHT for what? Yeah, you guessed it, balance. You must have contrast in order to establish harmony, yin, yang. What does it also do? It helps the transfer of testosterone into the cell for its primary role, growth and repair. Testosterone is an anabolic hormone necessary for normal physiology. Anabolic, catabolic, day, night. Rinse, repeat. So, why are we talking about it? Because it's the biggest pain in my arse. Because guys with low SHBG don't feel good despite having good numbers. So we think about ratios because it's all about ratios. And you look at the quantitative marker on the paper and go, your levels are optimal. Your free testosterone to estradiol ratio is perfect. Why don't you feel good? Well, it's not all testosterone. Address the fundamentals, lifestyle, diet, exercise, one more time, earn your reward. It's more involved than that. So as I've just said, SHBG helps modulate the ratio of DHT to testosterone to estradiol. So if it's got a higher affinity for DHT than testosterone than estradiol, on paper, you may look as if you have perfect numbers and that must translate into feeling sparkly. But in reality, that's not always the case. So what should we be doing? We should be looking to raise SHBG. The bros all want to lower SHBG, not because they're idiots, because this protein is super important. Testosterone is bound to SHBG and albumin. 98% of your testosterone is bound to these two proteins. Only 2% is free to be used as testosterone, converted to DHT and converted to estradiol. So obviously 98%. These two proteins, SHBG and albumin, are incredibly important. Testosterone binds tightly to SHBG and weakly to albumin because you want to be able to use your testosterone appropriately, appropriate for your needs. Live according to your physiology. Understand what you're supposed to do. You're supposed to be active in the morning to earn your reward. So your anabolic processes predominate overnight. You're repairing from the day to prepare for the next day, and you have high testosterone. And with high testosterone, that dopamine comes into action. Now, I've said this before. Is testosterone supposed to make you feel good? No, not really. It's not a happiness chemical. It's supposed to motivate you. It's supposed to give you the drive and determination to go out and seek your reward, which in hunter-gatherer days was obviously food. So, get up off your ass, use the testosterone. As the day goes on and you're physically active, your testosterone level will drop because you become more predominantly sympathetic and catabolic because activity is more catabolic than anabolic. They're not separate, but you are predominantly more catabolic than anabolic during the day, because you're seeking your reward. And if your testosterone level drops, your dopamine level drops. But I'm desperately seeking dopamine. Life is about contrast. You have to keep moving. And the reality is, you seeking dopamine through activity, hunting, reward, food, means you transition very nicely from a predominantly sympathetic state to a more calming parasympathetic state, which is the ultimate goal. But you must go through that process, because life is all about movement. And when we understand that, we won't listen to our emotions, we'll listen to our physiology. And when you can trust your physiology, your psychology will improve and your subsequent emotions will improve. But we don't want to listen to our emotions when we're not healthy human beings. And who's healthy? Not many people, because we don't live according to our physiology. We're all chunky monkeys. We're all relatively inactive compared to our ancestors. We eat what we want, not what we need. We engage in risky behaviors because we are desperately seeking dopamine, and I'm going to take it versus own it. So, low SHBG. It happens typically as a direct result of you not putting the work in. Metabolic syndrome, type 2 diabetes, hypothyroidism, the list goes on. So you've got subsequent low testosterone. So you jump on TRT. As flippantly as that. No, jumping on TRT is not recommended. TRT should be considered. You should do it fully informed of the benefits and the risks. You'll see these other companies. Testosterone gives you muscles. Testosterone will improve your libido. Testosterone is a foundation hormone necessary for optimal physiology. That's it. Put the work in, then you'll earn your reward. Testosterone is not a cure-all, fix-all. You must understand that. So, you've got low SHBG, you jump on TRT, and you don't feel amazing. Well, there is careful dose titration according to response. What you must understand that microdosing, all my patients microdose, whether irrespective of low SHBG, normal SHBG, high SHBG, because again, the premise behind therapy is to mimic physiology for optimal well-being, day, night. By the very nature of injecting, you're going to cause a peak. And what are we trying to do? Cause stable levels, but mimic physiology. So a peak in the morning by injecting, as close as damn it, mimics physiology. So careful dose titration according to response. You have to trust the process. If you are on a less intensive injection protocol, you're going to be in trouble, because the reality is that SHBG isn't mopping up that testosterone. As I've said before, the buffer effect, it grabs hold of DHT, then testosterone, then estradiol. So you will have a relative high estradiol compared to testosterone. And we know how that feels. Anxiety, emotional. It's been emotional. We don't want that. We want you to be balanced. We want you to be considered, content, calm. Because again, testosterone is a calming hormone, not a reactive hormone. It's all about balance, baby. So you must microdose if you've got low SHBG. You must realize that there is careful dose titration, and trusting the process is integral to success. Short-term gains, long-term losses. No, we're about sustainability here. It's not a marathon. It is a marathon. It's not a sprint. It's a marathon. So you've got to put the work in. I try and drum that home to all my patients, because I can get you there pharmacologically. You've got to keep yourself there. And if you've got work to be done, and lots of us have got work to be done, put the work in, hence earn the reward. Understanding your physiology. Again, day, night, day, night, day, night. Again, first part of the day, activity. Second part of the day, rest. So to increase your SHBG, put the work in. Stress reduction, sleep, hygiene, nutrition, exercise. I'm going to take that back a little bit. Stress. Now, we're talking about psychological stress because that isn't natural. We're physical beings in a world full of psychological stress. But we're physical beings, so use your body physically. But as I just said, hunter-gatherer, first part of the day, stress, hunting. Practicing intermittent fasting, placing your body under the necessary amount of stress it needs, will help raise SHBG. Reducing carbohydrates will help raise SHBG. The only reason why we eat so many carbohydrates is because when we moved from small communities to large communities, there was no way of feeding us all. So hence farming came into place. So you can hopefully optimize your SHBG through lifestyle, diet, and training. Microdosing often yields an increase in SHBG because not only are we achieving stable melandrin levels and mimicking physiology, we're allowing you to put the work in to earn the reward. And again, if you understand physiology, then you will become more healthy as a direct result. That's it. It's very simple. Now, if SHBG doesn't rise, you really do need to be under a clinician that knows what he's doing. Because, again, we fixate on the numbers because the numbers are so important. Everything's important. How you feel, what you do, the numbers, everything's important. So you must have a holistic approach to your health. Understand that contrast is necessary to establish harmony. And go out and do what? Yeah, you guessed it. Go earn your reward.